Welcome to COVID Talks. Today I have the pleasure to talk to Dr. Richtard Idro. He is a pediatric neurologist at the Mulago Hospital in Kampala, the capital of Uganda, where he also teaches at the Makerere University. And he is the president of the Uganda Medical Association. Welcome, Dr. Idro.
Thank you. Thank you very much, and welcome to you. It's a pleasure being here with you.
In Uganda, a country with 35 million inhabitants, we have currently 101 notified cases of COVID-19 infections. Nobody has died so far. So, Dr. Idro, why should we talk about COVID-19 and Uganda?
Yes, Dr. Kovac, Uganda is a very unique country. It is right across the equator and within East Africa, in a region with so many Great Lakes. It is known for very many viral epidemics. So we have had repeated epidemics of Ebola, Marburg fever, the Crimean hemorrhagic fever, yellow fever, and more recently we had another virus, and a new one called Twetwe virus. But COVID-19 is a new one, just like in the rest of the world. And in Uganda, we had our first case reported in the third week of March. And to date, we have had 101 cases reported. The population of the country is about 42 million. And we have not had a single death. What has been unique in this country is that as the epidemic started moving from China into Western Europe, the government of Uganda started putting in place interventions quite early. And for example, by the beginning of March, we had closed down schools. We had closed down public transport. More than 40% of the population, 70% of the population in Uganda is young. They are young people under the age of 17, under the age of 18, and we have of the 42 million, 15 million are in schools. So the first intervention was to try to interrupt large gatherings, and schools provided one of the largest gatherings. The second one was to stop public transport. And so we stopped public transport quite early, before even the first case was detected. And arrangements were in place to stop transport coming, air transport coming into the country. And it was in the last days of those days that we had the first case being reported. And since then, literally most of the cases we have in Uganda has been imported. The first 50 odd patients, most of them came from either the areas of the Arab Republics, United Arab Emirates, or some of them came from Western Europe, the US and Canada. But in the last, I'll say 3 weeks or so, most of the cases have been of truck drivers from our neighboring countries. So truck drivers who are driving goods from the coast, especially from Kenya and from Tanzania, and along the Indian Ocean coast. And then a few people who have been exposed to this. Within the country, as health workers, we had initially set up 2 treatment centers, and the majority of these cases have been treated in 2 treatment centers, one which is near the airport at Entebbe, and then the other one is in Mulago Hospital, where we isolate. And almost all these 101 cases in Uganda have been either mild disease or asymptomatic disease. So about 50% have been very mild diseases, and then the other one is asymptomatic. I may say that there has been only one moderately sick patient. The rest have been patients with mild symptoms, and the other 50% are asymptomatic. and we keep them, and we have been isolating them in the hospital, and for about 14 days, and thereafter we have at least 2 negative tests before we release them in the community. One of the things which I think has helped Uganda deal well with this is our experience with the repeated viral epidemics. We have built a lot of capacity in the country because of managing the other epidemics, the Ebola epidemics, the Marburg epidemics. So we have an integrated disease surveillance system around the country, which works in a network. And the Ministry of Health really deals fairly well with this. And so when the COVID epidemic came around, this system was activated.
In Uganda, people are very much relying on public transport, especially in the big conurbation area of Kampala. People need all these structures of public transportation. And for many of them, that is crucial to make their living. So the lockdown must have been a very, very severe measure to many people in Kampala. I assume that you as physicians have welcomed or agreed to this measure because otherwise it would be very difficult with a high number of cases. Is that correct?
Absolutely, because the city is quite crowded. It is Kampala city has over 2.5 million people during the day in a very small area, so the population density is really high, and so there's a lot of crowding. And if this public transportation was to continue, it will be very difficult to control the disease. So this has been a necessary measure, which actually even the population, I think, has appreciated, although extreme, but people have had to take these painful decisions to accept and deal with it.
Has your government considered now, with seeing the COVID-19 pandemic spreading out over this world, to increase also the surge capacity of the healthcare system in Uganda, which means investing more in, for instance, ICU capacities, ventilation capacities, because something like this may happen again?
Yes. So since the epidemic came about, the Ministry of Health identified the 14 regional hospitals, in addition to the 2 which have been in the center, which I talked about. And in each of these hospitals, they have recruited additional staff. And right now, there's a plan to install high dependency units and ICU capacity in each of these hospitals, between 6 and 10 beds. And this ICU capacity is being built, and I think in the near future, a lot of it will be installed. There's certainly a lot more which needs to be done in terms of infrastructure in all the hospitals. The capacity is certainly inadequate, but at least there's now attempts to try to improve this. And it is believed that somewhere towards the end of this month or early next month, several of these units will be functional. And indeed, right now, about 4 of the regional referral hospitals are treating some of the patients with COVID, although none of them has so far required ICU care.
Some of the countries, especially in Europe, are already loosening their restrictions. What are the perspectives for the lockdown in Uganda? Is there any idea how long you will go on with these harsh restrictions, or is this still open?
So initially, the country locked down for 2 weeks, and this was then extended for 3 weeks. And early this week was extended for another 2 weeks. So currently we are working up to, I think, about up to May 19th as the lockdown period. Although in the recent extension, there has been some loosening. So a few shops dealing with construction materials and have been opened. And some of the trucks which are moving materials and food around the country can now take an additional person to support the driver. So there has been some relaxation in some of the rules, but essentially still public transportation the gatherings around funerals, weddings, all this, a lot of them still are on hold. And there's a scientific committee which sits and advises the Minister of Health. They sit twice every week, and then passes this information to the President and the National Task Force in cabinet, and they review the evidence and they make decisions based on partly on this advice which they receive from the scientific committee.
Thank you for taking the time, and thank you for giving me this interview. And I wish for Uganda that there will be no more new cases of COVID-19 and that it stays as calm as it has been until now.
Thank you, and pleasure.